Hi, I'm Dr. Judy Gooch, and I'm back for Brainstorm for Brain Injury. As you may recall, I'm a rehabilitation doctor and work with a lot of people who have had brain injuries. And Brainstorm for Brain Injury is trying to improve understanding of brain injury. Brains and brain injury are difficult to understand. And so we're trying to help brain injury survivors live better, and people who live with brain injury survivors, we're trying to show them how to understand the brain injury survivor and to help the brain injury survivor. So what I'm doing is giving stories of people that I see in clinic. And I'm changing the names, I'm changing the ages a bit to keep it confidential. Today, I'm going to tell you about a person who's had a stroke. As you may recall, a stroke is when a part of the brain does not get enough blood flow. Maybe the blood vessel is blocked, maybe there's a bleeding area, and when the brain doesn't get enough blood flow, it doesn't get enough oxygen, and then some of the brain tissue dies. So when you can have a stroke in different areas of the brain, but typically if you have a stroke in the right side of your brain, remember you have weakness on the left side of your body, or left hemiparesis, stroke on the left side of the brain, weakness, also called hemiparesis, on the right side of your body. But after a stroke, you don't just have weakness, there's other issues. And today I'm going to tell you about Carol. Carol was 72 when she had a stroke a couple of years ago. She had a stroke in the right side of her brain, and so she had that left hemiparesis. So she had weakness on the left side of her body. It improved over time. She's left with a little weakness, but not all that much. But Carol had significant difficulties. One of her greatest difficulties was neglect or inattention to the left side of her body. That can happen frequently after a right brain or left body stroke. So in Carol's case, when I had her close her eyes and I touched her right hand, she was able to say right, touched her left hand, she was able to say left. When I touched both hands, she said right only. She kind of ignored that left side. Now, Carol also tended to run into things in the left side of space, into doorways, kind of walking down the hall. She'd kind of sometimes bump the wall. Also in neglect, if you have somebody draw a clock, put all the numbers in, with neglect, often people only draw the right side of the clock. It's kind of weird. Have them put marks on a line. You put a line across the paper and have them put marks on it all the way across. Well, often they only put them on the right side. At its worst, and I saw this first in residency, a person doesn't even know their body part is their own. I saw a woman with a stroke. It's a pretty significant stroke, and she had weakness on the left side and picked up her left arm, and I said, well, what is it? She says, I don't know. I said, is it an arm? She said, yeah. Whose arm is it? I don't know. She did not know that it was her left arm. And that is kind of the most extreme example of neglect. And usually this happens with right brain or left hemiparesis, not so much with the left brain or the right hemiparesis. I don't know why, but it does. So before her stroke, also Carol was an avid cyclist. She bicycled all over the place, very fit, very healthy. And she was really missing that. So in clinic, I told her about Wasatch Adaptive Sports. They're an adaptive sports program in Salt Lake City, Utah. And in the winter, they do adaptive skiing. And in the summer, other seasons, they do adaptive cycling. And basically, they help people with spinal cord injury, stroke, brain injury, all sorts of motor difficulties get out and cycle and be active. It's wonderful. So I talked to Carol. I said, well, how about getting into Wasatch Adaptive Sports and doing some cycling? And she said, I don't want to do adaptive cycling. I'm going to wait until I can just do this cycling regularly. Well, Carol's stroke was 2 years ago. The chance of her getting back on a regular cycle was low. Her balance was decreased. Again, she had that significant neglect. She'd likely just veer off the road and not really understand where she was going, which would be a real safety risk. But another thing that happens often with left hemiparesis, right brain stroke, is kind of a denial of deficits, denial of difficulties, decreased insight into your difficulties. And again, this is much more common with left hemiparesis than with right hemiparesis. And that, as you might guess, can make life more difficult. So it's not just weakness on the left side, but it's these other issues that people can struggle with. Also with that left hemiparesis, you can have a lack of safety awareness. You can be more impulsive. So, and Carol's family was struggling with some of her impulsivity. She just wanted to kind of go out and do things safe, not safe. And this was not like Carol. Carol was a very safety conscious, fairly reserved person before. And so this was not like her. And her family was kind of not knowing exactly what to do with this. So what can you do about some of these things? Well, Carol has started again getting physical therapy, and they're working on her balance. Also, they're working on compensating for that lack of left-sided awareness. She's learning to scan her environment more, really look over to the left more, and practicing that. And that can improve some of these issues. She is also getting cognitive therapy, done typically often by a speech therapist who is trained in cognitive therapy after brain injury. And so she's working on some of the awareness of her impulsivity. Now, is it likely it's going to go all away and get totally back to where it was? It's not that likely. It's possible. It's not that likely. But can you improve it? Can she improve it? Yes, she can improve it. So she'll go ahead with these therapies, and I'll see her back in a few months, and hopefully she's made some gains. Thank you.